Good day, and thank you for tuning in to this new episode of the Microdose Diet. My guest today is Maria Velkova. Maria is managing partner at Tabula Rasa Ventures. Tabula Rasa Ventures is a VC firm focused on opportunistic investing in the psychedelic space. Maria herself has extensive experience and expertise in the healthcare industry, having advised global leaders such as AstraZeneca, Roche, or Pfizer, to only name a few. My name is Peggy van de Plassche. I'm a former banker and venture capitalist. I now speak and write about the psychedelic industry and the benefits of strategically microdosing psilocybin. I created the Microdose Diet, which is a 90-day plan for success and happiness. You can follow my work on socials, Substack, LinkedIn, YouTube, Apple Podcast, and Spotify. So Maria, thank you so much for being here today. It's really a pleasure. And, I can't wait to hear your insight.
Yeah, absolutely. Thank you so much, Peggy. The pleasure is all mine. I appreciate you having me on your podcast, and I'm hope to share some interesting stories and insights about how the psychedelic therapeutic space is rolling out, and what's our part to play in it.
That's wonderful. Well, we're going to dig in right into it. So you have a background in science and healthcare. So what drew you to focus on psychedelics?
Thank you. Yeah, that's definitely a question that everyone asks to people who are working in the space. My story is twofold. One is more personal, and the impact it's had on my personal life, and the other aspect of why I'm working in the space is more kind of like intellectual curiosity. But yeah, I was born and raised in Bulgaria in a small town in the mountains called Velingrad. 10,000 population, and actually in 2000 my dad won a green card in the lottery. It's true and it's real. So my family immigrated to the US. We came with like $2,000, and it was a quite hard transition for me. I didn't speak any English. My parents worked multiple jobs and going to night school. So I had like some trauma from that transition, cultural shock. And our traumas are sometimes and can be channeled into being our best toolkits. But in the first kind of like period of my life through my teenage years and early 20s, the trauma was impacting me kind of in a negative way. Although it helped me achieve a lot of everything that I achieved until that point. And so when I graduated high school, I wanted to go back to Europe and to continue my higher education there. So I moved to the UK. I did my undergraduate degree in pharmacology, and then I did my master's at Cambridge in bioscience enterprise, a really fantastic program that merges science and business together and entrepreneurship. So during those years and kind of like my growth and development, I was ticking all the boxes of, what you're supposed to do to achieve success and happiness, valedictorian, best university, best career, etc. But I kind of feel very uncontent, and I felt like there was a lack of alignment to purpose in a way. The typical immigrant story where, we're working super hard and ticking all the boxes, but although I love the area that I work in, I just didn't feel fulfilled. So that's one of the angles, kind of like where psychedelics played a role in my personal life, in my personal development and growth. The other aspect is, of course, my curiosity about how the body works on a molecular level, specifically the brain. I've always been fascinated with neuropsychopharmacology, and was quite shocked that, psychedelic therapeutics, anything about them was not covered in the curriculum, although, these medicines were highly researched and prescribed in the 50s and 60s before the war on drugs. So finally, after spending a decade in corporate, working with big pharma, as you mentioned, decided that it's time to leave the corporate world and contribute to the emerging psychedelic therapeutic space. So in 2020, left big pharma and I was able to generate a wealth of knowledge and experience in how to take a drug from the lab to the patient, all of the intricacies of the process. And a lot of people who focus in the pharmaceutical space get specialized, or any big corporate actually, get specialized in one vertical or area and become experts in it. But early in my career, I noticed that there's massive silos. And since I always wanted to go early in innovation, and it requires wearing all the hats when you're that early in innovation, I decided to diversify my experience and skill set. So I've done everything from R&D to clinical trial designs for Parkinson's disease drugs. I've done regulatory strategy, commercial rollouts of blockbuster drugs, M&A operations, you name it. I really wanted to know how, what it takes to take a drug from discovery to patient and clinical usage.
That's amazing. I love though you weaved your personal story and your expertise, because many of us who are in the psychedelic space actually came for our own healing. And then, we love the intellectual challenges. I think we're all very innovative in nature, and that's really what is driving the industry forward. So I'd love to talk more about Tabula Rasa Ventures. So Tabula Rasa Ventures is a fund that is focusing on psychedelics, but also an accelerator and a startup school. So could you tell me more about the business model, and why did you and your partners thought there was a need?
Yeah, oh, absolutely. And that's kind of the continuation of the story. When I came back in 2020 and started mapping out the psychedelic space and really understanding this very new but ancient emerging space in modern healthcare. And interestingly enough, I was probably one of the first people to leave big pharma and come into this space. And as I was meeting more and more stakeholders in the space, everyone kept on mentioning the name Marie Kazan. And I joined in 2020, Tabula Rasa Ventures, but he actually had started it in 2018 at the very conception of this space as an industry, with capital flowing in, with companies emerging, with research developing. So his background and expertise, he spent a decade working with entrepreneurs, early stage companies, accelerators, incubators. So really diligencing deals and also helping these entrepreneurs grow their companies at the early stage, but very evidently, this is a drug development space, and that is a very complex and well-defined process. Yes. Yeah. So he was looking for a drug development expert, and I was looking for someone with track record in early stage venture. And literally, when the frame of 2-3 weeks, I had like 5 people mention the name, and I was like, oh my God, I guess I have to meet this guy. So we got on our first phone call, and we shook hands, and we've been inseparable ever since. He's my work husband.
Yeah. Oh, that's great.
But very synergistic in our expertise, but also in the way we want to build our organization. So on Tabula Rasa Ventures, back in 2018, actually, a lot of investors were kind of laughing at him and saying it won't be another decade until a fund makes sense in this space. It's so early. There's only 3 companies. Yeah. But Marique was at Yale at the time and working with his professor of venture capital, and had done some analysis, and by the pace of how companies were emerging and the interest in the media was growing, yeah, and the interest in alternative investors and forward-thinking investors was developing, he definitely thought that within 2 to 3 years there will be definitely a space for a fund and venture capital investing as the deal flow increased. And instead of waiting around until that time came, he started building infrastructure for the psychedelic space, and he built out the first incubator. We've taken 18 companies through that. That's really early stage companies, pre-revenue, almost like right at the at the time of, initiating fundraising for their business. And we had a couple of exits out of those companies that we supported.
Mm-hmm.
Outside of the incubator, which was more like a structured 3-month program, we actually started diligencing deals and connecting the best ones to investors through direct introductions, which actually was super beneficial because it helped us build a track record in the space, which is very helpful now that we're raising the actual fund. Outside of this work with entrepreneurs, we launched the largest conference in the psychedelic space. It was in 2020, so it was virtual. But actually, the first in-person component was last year in Davos, alongside the World Economic Forum, which was pretty crazy to do, to be honest. Up until the day of and the whole week, we were like, oh my gosh, how is this going to be perceived in, this place where all the top % of global leadership gathers once a year. But it was extremely well received. We brought 85 of the top experts in the psychedelic space, and we really wanted to make it heterogeneous and representative of this industry. We didn't only bring investors and companies, but we also brought the nonprofits, we brought indigenous leaders, the scientists, the clinicians, the policymakers, the media people, and it was really representative of the space. And I think that really was one of the points that inspired a lot of people and how we kind of put that together. So since I joined and over the course of the last 6 to 8 months, we started building the fund. We had the track record, we had kind of the PR, and we've really shown that we can execute in this space. We decided that it's time to really raise the fund. It's a $25 million fund, which focuses across not only drug development in the psychedelic space, but also clinical and medical infrastructure, and also digital therapeutics and tech. And this is an industry that's being built from scratch, or Tabula Rasa. Exactly. But intended. It's important. All of these pieces are important. We're redefining the care delivery model in psychiatry and mental health, and a lot of aspects are necessary to ensure the successful and broad access to these therapies and their launch. So the fund, we did a first close in December, so we're kind of at the very beginning. We're actually currently going through a second close. We have now more than 7 million committed of the 25. We've started deploying in several deals as well, really exciting companies across these different verticals that I explained. So the way we operate, which is also our value differentiation, is that we don't only invest capital, we actually work with these companies for 3 to 6 months, and we really help them hands-on, depending on what their key needs are. For example, we've done executive recruitment, and of course my network from Big Pharma is starting, I'm just starting to scratch the surface of it, but I'm very excited to utilize that. We help with BD and partnerships. We make introductions in the entrepreneurs lens. We're kind of like the gateway to the psychedelics industry, and we're the only fund that invests as early as pre-seed with that kind of a model.
Okay, that's fabulous, and thank you for sharing. As we discussed a bit offline, I was in the tech space very early stage, and to your point, capital is key, but many entrepreneurs need this expertise, but also the Rolodex and everything that's going to make them successful. Bigger, faster, better. So I think it's really the right model as you start. So I don't want to make you pick your favorite child, but what companies, what business model do you really like right now, and why?
Well, if I didn't say all of the ones in our portfolio, then I would not be a good investor.
Exactly. Yeah.
And I don't like picking, but I'll give a couple of examples, or like 2-3 examples, more high level, and why. on the drug development side of things, it's worth to kind of mention there are like the way that they're viewed drug development companies in the psychedelic space is you have the classic psychedelics, which are known molecules with data from the past and also have been used recreationally. And then these compounds are kind of like using a shortcut because hundreds of thousands of people have been dosed underground. So, the main point of clinical development is to ensure efficacy and safety. So we have a lot of anecdotal data to know that they're safer. So the energy around and how we feel about, the classics is like, we know that they work. We just have to collect the data to show in our modern system, to the highest standards that it actually works, and actually also figure out how this fits in our current healthcare system. How is it different, how it can plug in, etc. So that's a very important first step with the classics. The other kind of group of compounds are the novel chemical entities. These are patentable drugs, and these are companies working on these drugs are innovating on the molecular structures, which are inspired by the classic psychedelics, but they're improving, for example, the toxicology profile of a drug, or for example, they're shortening or even removing the trip aspect in certain indications like traumatic brain injury. Maybe you don't necessarily want to put the patient in an altered state of consciousness. Of course, we're collecting the data, but this is kind of like the general feel around it. So we are interested, and given that we're that early stage, we're interested in companies that are taking novel approaches and looking outside of depression and anxiety, which are, of course, very important. But with my investor hat on, there's super interesting companies. For example, 2A Biosciences, they're using novel compounds which are inspired by the classics, but they're researching them for inflammation, kind of like psoriasis or skin inflammation. So for us, that's extremely interesting. Of course, the caveat on that is you have very novel stuff, but that's going to go through your classic drug development pathway, which takes, up to 10 years. So that's very interesting on the drug development side. In terms of clinical infrastructure, medical infrastructure, my really favorite company is called Enthea. They're the first company to provide insurance for psychedelic assisted therapy, starting with ketamine, because that's the only one available now. They're using a really interesting model by leveraging health benefits through employers. And when I was diligencing the deal before we invested, and we're lead investors in that, I was looking for like comparables in other industries that use this like TPA, third party administrator model. And the way that they work and why they're important is that they're really in the core of the industry, and they're touching every stakeholder in the space. They're touching the payer, they're touching the prescriber and provider, they're touching the patients, they're touching the drug development companies. And basically how they work is that right now they're building out a vetted and credentialed network of providers. So because this is a new space, there's not really an accreditation body yet. And there's a lot of different clinics, but there's not like a body for quality control and ensuring that these prescribers and providers are working at the highest quality of standard. And so they're building that out. They've built an accreditation process, and that's very important to keep the integrity of everyone, to make sure that the patients are, receiving the highest quality of care. On the other side of things, on the payer side, the way they're operating is through employer health benefits. Now, why would employers want to cover psychedelic assisted therapy for their employees? Well, why not? Big corporates, and like after COVID, a lot of people are struggling with a lot of anxiety and stress and depression. So if you can show through data that these type of therapies are improving employer satisfaction and productivity, that's incredibly valuable for employers, because actually employee recruitment and training is pretty much the most expensive part of running a company, where the biggest asset is the employees. So going back to the comp that I mentioned, the comparison, a similar model was used in fertility, like IVF, egg freezing. And until today, still TPAs are like kind of like some of the major insurers for these kind of fertility services. But and they're using employer benefits. And why employers? Well, women in their early to mid 30s are faced with the decision of, do I have a family and babies, or do I continue my career? And they're at the peak of their career, so it makes a lot of sense for employers to give that peace of mind, to allow women to make the decision of maybe they want to delay a little bit, but with a peace of mind that it's not going to risk their intentions for having a family. These are just two examples. There's many more. There's some on the text, but
that's very, very helpful, because I think for people who are listening today, understanding how wide the psychedelic space is when we're talking therapeutic, it's not just the drug, it's all. I love that you're investing in insurance. Financial services is I would say where I spent 20 years of my life. So it's dear and near to my heart. And I think it's very, very smart to go in every aspect. So, and for you, it obviously limits the risk for your fund, because you're diversifying while benefiting from all the different areas. So I think it's amazing. So I have a couple more questions for you. One, I love on your LinkedIn profile and on the website, there's this mention of investing in healthcare's biggest blind spots. So do you want to tell me a bit more about that?
Yeah, absolutely. Well, we're not a one fund play. We have decided that we'll dedicate our lives into building the future of healthcare, and that's like a long stretch into the future. But our long-term strategy and vision is focusing not only on psychedelics, but on across different types of therapeutic contexts that will transform the way we look at healthcare. Because today, and for the past century, the way that our healthcare system has been built is around disease. So we code different therapies and different procedures based on the disease. The World Health Organization has the whole almanac of what are the different diseases. Insurance is around disease. The hospitals and clinics are around disease. Our specialties of doctors and practitioners are around diseases. So if you want to create a true health system that's focused on health, there needs to be some changes. But also it's very important to mention, you can't do this 180 flip, over a short period of time. It needs to be incremental and very well thought out. And it does need to include our current system, because unfortunately, hopefully one day, but unfortunately, people will continue getting sick and needing that kind of care. So our longer term vision is really investing in innovations that are driving our sick care system more into a healthcare system that focuses on prevention, health optimization, regeneration, through regenerative medicine, holistic healing. And a lot of these things are like, Eastern medicine, or, shamanic, or, witch medicine. But, these are important. That's an important area that we haven't really explored. And we're starting with psychedelics because several reasons. One, the research is just the perfect setup. I don't know about many other health spaces where we have already data from that we understand how these sort of work on a real world aspect, real world evidence wise, and also that they're safe. Second thing is that the whole need to build out this infrastructure that surrounds it with the insurance, with the accreditation, with the clinic systems, with everything that comes, like the picks and shovels, to ensure the rollout of these therapies is successful and broad. So we really believe that the psychedelic space is catalyzing the initial steps of the building blocks that are necessary for a system that's truly focused on health. And of course, the psychedelics psychedelic therapeutics are first focused on disease. But, anecdotally, we very well know that they can be also preventative. So it will take time to get there. But for further and future funds, we'll be focusing on regenerative medicine, holistic health, sexual health as well, which is very taboo. So everything that you think is taboo, but actually has evidence, anecdotal evidence at least, into its impact on health optimization and preventative health, are kind of the areas that we look into.
Oh, that's fabulous. Yeah, I just find it's funny you mentioned that, because I am so over the current healthcare system, which I think is totally upside down in their approach of health for people. I cannot let you go without asking you a last question. You're an investor, so obviously we're going to talk valuation in the space, and we know that it has been a bit challenging, to say the least, in the private and public market right now for psychedelic and for the world in general. So what do you think investors need to see for the valuation in that space to recover?
Really great subject. I actually was speaking at Benzinga Psychedelic Capital as a conference here in Miami a couple of days ago, and touched on this very real subject. The one important thing is, if you have capital, if anyone has capital right now, it's the best time to invest. And the reason for this is, one, agnostic to psychedelics, valuations are dropping, but specifically to the psychedelic space, is that just as every nascent industry that's emerging, there will be a hype cycle. We've seen that and these are very different, but they're kind of like novel spaces. We've seen that in cannabis. We saw that in crypto, very different. But in terms of the hype curve, with valuations, something very new, very exciting. Initially, in the last 2 years, valuations were ridiculous for psychedelic companies, and it was an entrepreneur's market, and there was so much competition to invest in these companies. It naturally hiked the valuations up. Expected, okay. Now, especially with the general market downturn, valuations are starting to become much more realistic. So this is really good news for investors. Of course, if you are positioned to be investing in this market, we certainly are. And so valuations are dropping, and it's important to say that, this is not just affecting the psychedelic therapeutic space, although because it's even newer, it's affecting it slightly more. But if you look at the biotech FTX, the index, in the past year, it has been trending like almost 80%, the psychedelics index to the biotech index. So in a down market, the first things that affect there are the very early risky companies in the biotech space. Since 2018, there were like 62 IPOs, and I think 10 out of the 62 that are still alive today lost 90% of their value, and up to 27% have lost more than 50% of that value. So everyone's affected by this, and it's harsh and hard, and it might get, and it's likely to get a little bit worse before it gets better. But we're likely to see a very mild recession, but it's heading in that direction. However, the Fed is starting to decrease interest rates. And if you think about this, whole financial system is all linked up, so it will take a little bit of time to cycle through the impact of the lowering of the interest rates. But hopefully, in the next 2 quarters, definitely before the end of the year, we will see more liquidity in the market, coupled with the lowered valuations in the psychedelic space. It will be definitely an investor's market, and hopefully more people invest into the space. It's critical and important. A lot of people are struggling with no options, especially after COVID, and especially after, this market downturn. So we're definitely dedicated. It's been much harder to fundraise for everyone, not only funds, but also companies. However, we are very blessed and fortunate that, it's slower than desired, and it's definitely not 2021, but everything's moving forward in favor in our direction. We are excited to continue supporting the space through capital, through hands-on support, education,
that's wonderful to hear. And I agree with you. It's going to be an investor market. It's already an investor market to some degrees. It's always difficult to find exactly where is the bottom and invest just at the right time. So I think we're already pretty much there. But you're right on time to leverage that. We'll put your contact information, obviously, in the podcast, in the YouTube video, also in the newsletter. So if some of our investors who are listening and looking at this video or listening to a podcast want to invest, what's your minimum? You're taking, I guess, also high net worth individual check, not just institutional?
Well, the mass of investments, not just from Tabula Rasa Ventures, but in general, has come from individuals so far. But institutionals are starting to really gain interest in the space as well. So even our conversations have definitely evolved more with institutionals and family offices. Our minimum check size is $250K. We have no co-investment fees for investments over $1 million as well. So investors can double down on, the investments we make. We're more than happy to get connected. No matter what your knowledge of the space is, happy to educate, happy to work together as well. And please feel free to reach out.
That's fabulous. And for Canadian friends, it's $250,000, so a bit bigger for us in terms of check. But thank you so much, Maria. Really, it's I think such an amazing organization you're having, and I'm really excited for you. Really want to wish you a lot of success. The space needs that. And your credentials, the credential of your partner, I think that's what the space needs. People who really know what they're doing, who have a pedigree. So really wishing you all the best. And thank you for taking the time today.
Thank you so much, Peggy. Thank you for having me.
Thank you. Bye-bye.